If it is not happening, no problem.
Good morning, sir.
Yeah, 1 second. Yeah, that's fine. Too many sounds are coming. Try to control the sounds. Yeah, that's fine. Yeah, Sangeeta, so you are the first candidate. So how much time you want to prepare? Okay, you can stay online. You can do whatever you want. Okay, once you are ready, let me know in the chat box that you are ready and I can schedule your speaking test. And the card is this one, insulin injections. Yesterday we have already practiced. Yesterday we have already practiced and you have written a lot of wonderful sentences the other day. Okay, so from that you can prepare, and then the card is here. So this is the card. This is the card. You can prepare this card. Right. You can mute back. You can go off the video now. Next, Laraib. Hello, Laraib. Are you comfortable? Are you at work or office or home? Let me know. Laraib, you can unmute.
Good morning, sir.
Yeah, good morning, Laraib. How are you?
I'm fine. How are you?
I'm fine. Are you comfortable, Laraib?
Yes, sir.
Okay, you can switch on your video. I'll give you some instructions. This is whenever I call you on video, that means you are spotlighted and you are special. Okay, so you can switch on your video for a minute. I'll give you the instructions, what we are going to do. You asked me, could you please tell me which card I will prepare? Yeah, yesterday I think you joined the session, and in that session you were there and you have written some sentences, wonderful long length answers. Okay, very nicely you have prepared. So for a second, you can switch on your video. Yeah, that's very good. You can turn, yeah, that's it, automatic. Very good. Hello, Laraib, how are you?
I'm fine, sir. How are you?
I really appreciate, I'm fine too. I really appreciate the way how you have responded to the question yesterday. I really, I did not even imagine, I did not believe my own eyes how nicely you have it. Of course, there were mistakes, grammar mistakes. There are many other things to discuss, but that is not the matter. How much desire you have to write good answer, that is what it is. You have written very well, and I really appreciated yesterday, and the same thing I'm doing today. Okay, fine. That's really good. That's really good. Okay, now you are in the second in line. You are second in line. So Larai Badil, you are second in line. And what you can do is you can prepare and you can get back to me. You take 5 minutes, 10 minutes, half an hour, 1 hour, 2 hours also, it's okay for me. Prepare well and come, because for 5 minutes you will be there on the screen. Okay, the world will look at you. The world will watch your speech. So try to do your best. Is that clear what I'm saying? Do
Yes, sir.
You are in second in line, but whenever you come, I will take. That's not a problem. Okay. So now the card is already sent. Ashwini has sent it to the group, our group, especially what's that? Christmas batch 1. Christmas batch 1. In that group, Ashwini has sent. Just check it out and prepare. You know the card, where it is, everything, and you know where you can get your sentences. Yes. I remember your yeah. So Control F, that is Laraib. Laraib, you have written 2 things. So this is 1. Okay, 2 places your name has come here. So number 1, this is the lengthy sentence which you have given. Know your blood sugar levels. That is number 1. And second one is, thanks a lot, sir. That's the only one part you have given, but that was very nice. You came a little late, but you have given once, instance, you have given the answer. That's what it is. And now you go and you prepare for this. Okay.
Okay, sir.
Yeah. The card. Prepare well. I want you to do the best. It should be a model. for everyone, right? Okay. Then yeah, you can switch off your video and you can mute your phone also. Yeah. So Kezia.
Yes, sir. Good morning, sir.
Good morning, Kezia. Hello. Yeah, Flipkart. You come upstairs. No, 141. Here, come up. Here. Mallikarjun Murugo. Very good. So, Kezia, you take your notebook and make a notes of what we are doing, who are the students, regular students. I told whoever I'm giving the name here, Sangeeta Patel, number 1. So you have to contact her name, everything one second.
Okay, sir.
Yeah. So, right. Yeah, Kezia, you can come open your mic and you can open your video. Let the students watch you. They should know that you are, yeah, from the fraternity of English language and literature. So Kezia, you can unmute. Right. Okay. Yeah. So this is Kezia, and Kezia is from Kerala. She has completed her bachelor's in English. She has become a part and parcel of our work. She's going to take speaking sessions for you all. So know her by her name. And yes, Kezia, you can have a few words about yourself. Where
Hello.
are you? Introduce yourself.
Hello, everyone. My name is Kezia, and I'm currently staying in Kerala. I did my bachelor's in English, language and literature. I'm waiting to do my further graduation as well. Thank you for having me.
Yes. So this is Kezia. She has been selected because she is from English background. She's not a nurse. She's from English background. So I selected people from English background because the subject is not a nursing or medicine, but the subject is English, and this is an English language test. So only English language professionals can support you the maximum. Mallikarjun, you can stop your video. Yes. So only people from English language background can help you the most. So that is the reason why I take English background people. So Kezia, welcome on board. So your role is to assist each and everyone and make a list of the people, whomever I'm telling. So slowly, you'll be knowing. So for the number 1 is Sangeeta Patel. She's from Gujarat. Okay, so you'll be conducting speaking session for her on a regular basis every day. Next, number 2 is Laraib Adil. She's from Pakistan, but now in Saudi Arabia or UAE, I don't remember exactly. So she's from there. So Laraib Adil. So her name you can write. So slowly, you'll know one by one. You'll know everyone. So that's the point. Okay, fine. So, right, you can stop your video and your mic, and you can follow up how I'm going on with others. Yeah. So this is the card here. So students card is here. This is the nurse card. And here we have the patient's card or the role player's card. So the role player will be asking these questions or something. Okay, so very small. Role player will talk very less, only 20 to 25%. So 20 to 25%. So see here, very little, very little. They'll say, I'm unsure. Okay, I have been managing my diabetes very well until now. So why should I change? Then you will be talking so much. So this all you have to explain, like how you have done. 80% should be nurse's contribution to the role play. 4 complete minutes you have to speak and 1 minute for the role player. 4 minutes and 1 minute. So that's how you're going to do. So this is the first point. And this is the second point. Okay, and this is the third point. And here is the fourth one. And here is the fifth one. These 5 points are the main body. This is like a letter itself, but this is spoken part. There's an introduction, there's a conclusion, and points in between. Total, yes. First one is confirm the reason. So from there onwards, 5 points you have to speak. Yes. Oh, Christmas batch. So speaking card. Speaking of things like this. Yes. Right. So Sangeeta Patel, Larai Badil, you're preparing Tricia Rinsi. Tricia Rinsi. Good, welcome. Ashwini, you can contact, you can send a message personally to the students. Okay, whoever are there, you can send personally. And speaking sessions are going on. You know the students, you have saved the numbers. You can just message them and you can invite them. Yes, you can message and you can invite at Ashwini. Yes. Please send a personal message or please invite. Please make schedules for the students. They have given the timings, but you can ask them. I'm live now. I'm live now. So they can come and participate. Tricia, you can unmute. Hello, Tricia. You can unmute.
Yes, sir.
Yeah, how are you, Tricia?
Sir, I'm good.
Okay, are you at home or you're at office or where? Or how are you?
Sir, I'm at office.
You're at office. Okay, fine.
Yes, sir.
Then I mute the call, no problem. You can
Sure, sir.
silent because it's you're on duty. So maybe if you're comfortable, that's okay, right?
Thank you, sir.
If you're at home, I would have invited to come on the video and you can participate. Okay, but now
Sure.
just better to be silent spectator, right? Correct?
Sure, sir.
Yeah,
Yes.
yeah. Tell me, share your experience. Yesterday you have participated in the speaking session. Share your experience. What did you feel about it? What is it good
Sir,
or? Hmm.
so it was really good because the way I was speaking, then you just corrected me and I came to know that what I'm doing wrong actually. Because I used to think like, yeah, I'm doing it correctly because mostly people say it's like you speak in English, so it's better, you will be able to pass. But when you corrected me, then I able to understand that what all was my mistakes. How should I be so much more calm?
Yeah, that's fine. That's fine. Thank you very much. And do you have anything for us, any requests or anything? What are your problems you can discuss?
Sir, I have mostly problem in my reading section only.
You
Means
have
now I
problems in
understood.
reading.
Yeah,
Okay.
reading.
Yes, yes. You can write your problem personally to me so that I can invite you for some sessions or whatever. You can just say,
Sure,
I
sir.
have problems in reading, so and so problems, and tell about your experience, OET journey, how many times you have written, where you are from, all those things. So if you send a
Sir,
message, then I will,
sure,
yeah,
sure, sir. I will. I will.
yes, yes. So, hello, Ashwini. Hello, Ashwini.
Yeah, yes, sir.
Yeah, are you comfortable? You're at home, right?
Yes, yes, of course.
Yeah, can you come on the video? Let the students know that you are the coordinator.
Yeah, okay, yeah, sure.
Yeah, so they will identify, yeah, this is our coordinator, this is our trainer, Simon Peter, this is our, yes. So this is, so what you can do is you can auto rotate and turn this side like this, like 90 degrees. Yeah, that's fine. So this is Ashwini. Okay, she joined us some way back last year when I was in Kerala, and she was one of the best staff I had earlier. And of course, I attended her marriage also, maybe a month back or 2 months back. Is that Ashwini?
Yeah, you're right.
2 months back, right?
Yes, 2 months back.
Yeah, 2 months back, and I thought she will never return post marriage, but of course she has joined us, and she takes pride in helping the students. Yes, sir. Ashwini, introduce yourself. Tell about yourself. You are a coordinator. You are not an English trainer. You are a coordinator. How you are assisting? You just share your personal details, where you are from, and everything.
Yeah, hello students. My name is Ashwini. I'm from Kerala, and now I'm actually I really so happy working with Peter Simon sir. He's a kindly person. I really like, and that's why I joined again.
Okay, so she is the coordinator. So Kezia, this is Ashwini, and she will schedule your speaking sessions. She will discuss with the students, and she will fix the timings, and the list will be put in the group, and she will be sent to you and me. So you have to follow them up according to those timings, and you have to follow. It is your responsibility. Students are students, like children are children. Parents take care of children like that. We cannot say they did not call us, they don't know, they did not message us or like that. But we will take a responsibility from our side and we'll follow up with the students. Yes, Ashwini, it is your responsibility to fix the timings, and you ask everyone to see, for example, today, nobody has sent the timetable. You can ask personally, you can message them personally also. Please send your timetable and in the
sure.
group so that everyone will be motivated. Okay. So if they
Yes.
send also, you can post it in the group or you can ask them to post in the group every day morning. I send the timetable, follow it up with all the regular students, whomever you know. If you're, see, for example, yesterday in some groups you're posting, today you slowly, you all of a sudden everything will not come. Slowly it will come. Okay. It will take some time to digest everything. Okay, so this is what you are going to do, and we are going to be very special group. We are going, we are very special group, of course. You know how we do many things. So you are special. You are special because you are going to help many people. Many people. You are going to reroute, schedule, organize, program everything. You are program coordinator. It means you should understand what is the importance of the role. Is that clear?
Yeah. Yeah,
Okay.
yeah, sure.
So
Yeah.
exactly at 9 o'clock, you send all the material, or even before the previous day also, you can just send the materials, especially to our, what is that group, Christmas A and
Christmas
1.
present.
These two groups you have to send. That is more important. Others you can send next morning, no problem. So
Okay.
you can ask me, follow it up with me. What is the next day's program set? Give me in advance. So I'll give you 6 p.m. only if you want, so that you can send them the next day after 12 or early morning you get up or before you sleep, you can send them. These are the materials for tomorrow. So prepare them and print them and practice them. That's what you can say. Is that clear?
Yeah, yeah, yes, sir.
Okay, fine. Okay, fine. You can mute your, if you have any questions, you can ask me. Otherwise, you can mute your audio and you can stop your video.
Okay, okay. Thank you, sir.
Right. So I'll be giving number of things. I'll be giving a number of things. I'll be giving a lot of points to speak and read and listen and write and vocabulary, grammar and pronunciation. I'll be giving number of things. So it is a long session. I'll be always on the screen and I'll guide you many things. So first thing is what we are going to do. So we have two people now and then, yes. We'll be doing number of things. So the program, yes, the program, okay. The 7 sentinels is the program, or Control C. This is the program, okay. This is the program, okay. This is the program, fine. All right. So what are the things that we are going to deal every day? Yes, we are under training. We are under training. So the 7 sentences. Okay. The program orientation. Right. Fine. Now here we have the 7 sentinels. What are the 7 sentinels? What are the 7? Simon, sir, you have told 7 sentinels. What are these things? So we have not known earlier. Yes, we have not known earlier. So what are they? So there you can see here the 7 sentinels. What are these 7 sentinels? The 7 sentinels. The 7 sentinels are the 4 skills. No, 7 skills actually. 7 skills. There are actually 7 skills. Number 1. Number 1. The listening skill. Listening, the reading, the writing, and the speaking. We call it LSRW. So we can term this one as LSRW GVP. So there are 7 totally. Number 5, the grammar, the vocabulary, and the pronunciation. The pronunciation. So these are the 7 components. These are the 7 components: the listening, speaking, reading, writing, grammar. Many people don't know the spelling of grammar. Okay, many people do not know the spelling of grammar. Right. Yes. So they don't know the spelling of grammar also. Okay. Now coming to the point, why we should learn all these 7? What is the importance? What's the importance? Now you can say grammar goes into listening, speaking, reading, and writing. Vocabulary goes into listening, speaking, reading, writing. Okay. Then pronunciation goes into speaking and listening. So that's why we have to learn these things. Okay. We have to learn these things. Right. So next. Right. So these are called the dynamic skills: grammar, vocabulary, and pronunciation. We can term them as dynamic skills. The 4 language skills plus the 3 dynamic skills are the 7 sentinels together. So they are very important. They are very important. And the nature of these skills, there are productive skills and the receptive skills. Type nature of skills. Nature of skills. Nature of skills. Now, what do you mean by nature of skills? So you should know where and what of these things. First one is number 1, productive skills, or we can say receptive skills first. Receptive skills, and then you have the productive skills. So receptive skills and the productive skills. Right. Now, what are receptive skills and what are productive skills? Receptive skills are, first one is receptive, coming inside, that is listening. Listening. Then second one is reading. These are receptive skills. You receive information, you receive many things. Okay. So that is a receptive skills. And then you have productive skills. Productive skills are yes, productive skills are, hello? Yeah, you have come upstairs, please. So listening, reading. Then productive skills are speaking and writing. So you speak, when you're speaking, you produce something new. Listening, you don't produce anything, you just take it as it is. You just take it as it is. 1 second, please. Yeah, receptive skills are listening and reading. Productive skills are speaking and writing. This is one type of, analysis based on the quality, the way how you are producing or receiving something. Producing. Yes, please. Okay, sorry. Right. Yeah. So these are the things. Next one, um, presentation of skills. According to presentation, there are 2 types again. Control C. Yeah. Nature of skills, presentation. This is so this is oral skills. Oral skills, and these are written skills. Written skills. Oral skills are listening and speaking, and written skills are reading and writing. Reading and writing. So this is how we are going to differentiate. Oral skills, that means you are using your mouth. Written skills, you are using pen and paper. So this is the way how you have to get the things done. Okay, so now I want you to discuss what are the problems that you are facing. What are the problems that you are facing? So Shemi Francis, yeah, I asked you to get back to me. Shemi Francis. Hello, Shemi, are you at work or free? You can unmute. You are at home, right? Shemi Shibi, right?
Yes, sir.
You are at home, right?
Yes, I'm in home.
Yeah, fine. Ashwini, come on the screen. Kezia, come on the screen. Shabi, come on the screen. Start your videos. Okay, this is our student, and yes, yeah, this is Shemi Francis. This is Kezia, and yeah, so this is Kezia. This is Kezia. Kezia, she is going to take speaking session. She's an English graduate, and she's going to take speaking sessions for you. And every day, this is, you have to contact her. Tricia Rimsi, I am facing problems reading in Parsi and there is no one to correct my reading. Tricia, not here. You write it my personal WhatsApp. I'll follow it up, please. Okay. So, Shemi Francis. So, Kezia, this is our student. This is our student. And yeah, here we have. So, this is Kezia here. And she is our interlocutor. She'll be conducting speaking sessions. So what you have to do is, anytime you are there, you can give her a time and she will take one speaking session, and you can request, because your exam is coming close, correct? When is your exam, Shemi?
December 3rd, sir.
December 3rd. So Kezia, remember her, okay? Make a note down of her name, Shemi Shibi. Sometimes she writes the Shemi Shibi, sometimes she writes Shemi Francis. I don't know. Okay, I'm a little confused. Okay, so write down which name you want to write. Tell Shemi Francis or Shemi Shibi. Which one?
Shemi Francis, sir. Officially, Shemi Francis.
Okay, officially, take the official name. We don't want pet names. Okay, Shemi Francis is her name. Write down. Her exam is on December 3rd. Write down that one also. This girl, you have to give maximum attention. You take 3 or 4 or 5 or 10 speaking sessions also, it's okay. Ashwini, follow it up, okay? You should, tell Kezia, okay? You should discuss with Kezia and follow it up, okay? So Shemi should be given utmost importance because she's a regular student and her exam is on December 3rd. She has just 10 days. Okay, so others only one speaking session, but her you can take 1 hour continuously also, no problem. So Shemi, follow up, and when you are giving time, that time you be with her. Okay, practice, and at the end of the day, after practicing 10 or 7 or 12 sessions with her 1 full hour, then you can come to me and say, sir, I want to take 1 speaking session with you. Then I will take the speaking session. I'll give you feedback. Okay, don't ask her feedback. Don't ask her feedback. She's just making you prepare. So it is your role. I will only correct you. I will only. So her role is only to work as an interlocutor. You should know she's going to give you an experience as a real exam. That's all. Okay, she's only a patient. She's only an interlocutor. She is not a teacher for you. Okay, you understand? You got it? And those audios will be sent to me and I will discuss with you whatever you want. That's my problem. Okay, and your problem, right? Right? And then what you have to do is come to me. I'll conduct 1 speaking session and I'll discuss with you all your problems. Now, what is it? Number 3 is your name. So number 3, are you ready for the speaking session today? So you have to prepare. Number 3 is Shemi Francis. So now I have to remember you by the name Shemi Francis. Okay, no problem. Okay, Shemi Francis. So what you have to do is, Ashwini, send her Shemi Francis. Okay, right?
Okay.
In the group you can write and who is Shemi Francis? Just she will respond, or you don't. You may already know her name there. So you just send her the speaking session role play card to her, and she'll prepare. And you take 5 minutes, 10 minutes, half an hour, 1 hour, 2 hours also, no problem. Take your maximum time, Shemi Francis. Prepare well and come, because you are going to come live like this one. The world has to see you, and you have to prove that you are an outstanding student because you are Simon Sir student. Okay, prepare well. You understand? Read from internet, read or check from the book which I have sent. It is there in the Telegram channel. Sorry, it is there here in the Telegram channel. So insulin injections, many people have a copy post link. Yes, and here it is.
Transfusion.
Yeah, I'm sending here the link. So you can click on the link and you can just go there and you can get the PDF and you can download that one and you can go through many sentences of many people, how they have written. Okay, so you can create your own sentences and practice speaking loudly. And then when you're confident, come to me. I'm going to take your speaking session and I'm going to give you feedback for this one. Okay, is that clear, Shemi? Number 3, Kezian, note down. Number 3 is Shemi Francis. Okay, and she is a top priority. She is in the ICU now. Okay, she is in the ICU battleground. Okay, war front. Okay, if OET is going to attack her, she is the first person to be attacked. So you have to take special care for her and give her a particular time If you want, you can give 1 hour continuously or half an hour in the morning and half an hour in the evening. How you schedule, that is you both should take care. Okay, right? If the morning sessions are full, if you cannot manage, you can give evening session. That will be your overtime. Okay, if the morning sessions are full, she is now totally free only for OET. Okay, right? Okay, so that's done. And the next one, yeah, Shemi Francis, you can mute your audio and you can stop your video. And then next we are going to, then who is there? Nasra. Hello, Nasra. Nasra Muhammad, number 4.
Yes, Miss. Yes, sir.
Yes, Nasra Muhammad, can you come on the video, please? Are you at work or at home?
I am at work. That's why a
Okay.
little bit was late. Yeah.
Yes, no problem. Then if you're at work, don't open your video. And yeah, otherwise, you can just open your video for 1 minute and close it off, because they will see you, Kezia and Ashwini, just for them, so that they can recognize you. Otherwise, you can get back later when you're free. Will be on the platform many times. So no problem. If you're comfortable, only you do. Otherwise, no worries. Okay. So Nasra, this is
You want to
Kezia.
turn on the camera, you mean?
Yes.
You want me to open the camera, you mean?
Yes, yes. If you're comfortable, just for 10 seconds, that our trainer and the coordinator sees you. Yeah.
Yes,
Yes.
yes.
Yes. Yeah. So this is Nasra Muhammad. She is from, come on, introduce yourself, Nasra. Introduce.
Yeah, I'm registered nurse in Sharjah, UAE.
Yeah. Tell
Yes.
from where you are, which country you are, and what
Yes.
is, yeah.
Originally, I am from Somalia, and I live here in UAE. I'm registered nurse now. I have been nurse for 15 years, so I'm here.
Okay, Kezia, just have your word with her. Yeah, come on, Nasra, continue, sorry.
Yeah, so I'm planning to do the OET, inshallah, and migrate to UK.
Very good. Yeah, Kezia, to her. Introduce yourself to her.
Hello, Nasra. My name is Kezia, and I'm currently staying in Kerala. I did my bachelor's in English language and literature.
Okay, I think that's good. Yeah.
Yes.
Yeah.
So now, Ashwini, you tell her what is your role and what you have to do with her. She will send you the timetable every day and follow up everything. It is your responsibility. Talk to Nasra.
Hello, Nasra. My name is Ashwini. I'm from Kerala. I'm coordinating these all groups now. So I'm really happy to see you here.
Yes, yes. Okay, thank you very much. I appreciate it. And
Okay,
we'll be
Nasra,
contacting you, inshallah. Okay.
Yes.
Yeah.
So what you have to do, Nasra, is that you have the card yesterday you have prepared in the speaking session. Then now you have to prepare that one. Maybe you take how much time you want, whether half an hour or 1 hour also, no problem. Prepare very well. And when you come to me, it will be only 5 minutes you have to speak. Practice, because you have to be very confident. Okay.
Okay.
Right. Right.
Okay.
And you can type, you can message, you can come and you can message me and you can start your speaking session. Is that clear? Right.
Yes, the one we
Next
have done it last night. Yeah, it would be the same, the one we have done it last night.
Yes, last night. That is practice. This is presentation. This is real role play now. This practice.
Okay.
This is directly only you and I will be there and we are going to record everything. Is that clear now?
Okay, then. Okay, inshallah.
Yes,
Okay.
yes, of course. Then next, who is the next one? So you can stop your video and you can stop your audio also. Yeah. Next one is Sangeeta Patel. Okay, Shemi Francis. CG Jason. Hello, CG. Then there is, who is that? Faiga. Faiga, where is Faiga? Faiga.
Yes,
Yeah.
I'm here, sir.
Yeah, Faiga.
Good morning.
Hello, Faiga.
Yes.
Yes. Are
Hi,
you on
sir.
duty or free?
Yeah, on duty.
You are on duty. Can you open your camera for 10 seconds, please?
Yes, sure.
Yeah, please. That's so nice of you. Yes. This is
Hi, good
yeah,
morning.
this is the Faiga. Yeah, Faiga. She's very much interested. She's the one who brought Nasra. Okay, she said, I I'm studying OET. You also study.
Nasra is my best friend and she's my twin. But she's look
wonderful,
like me.
wonderful, wonderful. Now learn
Yeah.
about our team. This is our team.
Yeah.
There are many other people who are working, but active people are there because they are related to you. Others are background. Okay. So
Yeah.
tell
First
about
of all,
yourself, Faiga, in few
yes,
seconds.
yes. Yeah. First of all, I would like to thank you, sir, for this great effort with us and your patience also. I would like to thank you, sir. My name is Faiga. I'm Sudanese. I have bachelor degree in nursing. I'm a registered nurse in UAE. I'm working for Ministry of Health, Ajman, UAE since 2015. So I'm planning to take my OAT to immigrate for UK as well. And inshallah, I hope we will ace it, inshallah, properly.
Okay. Yeah, Kezia, this is a small child actually for me. Okay, a small daughter. Okay, so you have to take care of her. You have to be very
Yeah,
patient.
really.
You have to be very patient with her. All others are one side and Faiga is another side. Okay, you understand? Okay, she's a very small child and you have to her step by step in an orderly way. Okay, with patience, lot of patience. Like a mother takes care of her child. You know, others are grown up. Okay, she's a small child. You have to take care step by step. Okay,
Thank
and
you.
hold her with your fingers and move forward. Okay, yeah, you introduce yourself to Faiga.
Hello, Faiga. My name is
Hi.
Kezia. I'm currently staying in Kerala. I did my studies in Bachelor English Language and Literature. I'm so glad to do this with you.
Yes.
Hi.
So
Hi. Nice to meet you.
Nice to meet you as well.
yes, you have to message her and you have to take the timing. You have to take the timing. For her, you can give 2 slots of speaking. Okay. No need 2 slots, 1 slot only, but take twice.
Okay. Okay.
Okay, 1
Inshallah.
slot only, but take twice. Same thing repeated. So
Yeah.
give her something, then ask her to prepare again. We will be sending the audios, recorded audios in the group. So Faiga, what you have to do is we'll be sending the audios in the group, Christmas group. Then what you have to do is to take the audios and you listen, you write down all the sentences of everyone. Okay, and try to take the good sentences from everyone and put everything and practice. You have to do a lot of hard work. Okay, you have to do a lot of hard work. You have the desire to do the exam of OET in January, but you have to little be patient and work hard. More important is work hard. Is that clear?
Yes, yes.
You have to follow with her. Okay, right?
Yeah, sure. Okay.
Following with her is very difficult. Okay, she's very busy. Following with her is very difficult. So you have to follow her in every manner, and you have to see that you will do. She will do one speaking, one reading, one listening, and one writing. How much? If not full test, at least to part A or part B or part C. At least little. Okay, because we cannot force her to do everything at a time. So it's little. I told you, no, she's not experienced in OET. She did not write any exam. She's a new one, beginner. Okay. Right? Yes. Okay, Nasra. Okay, Faiga, thank you very much.
Thank
so this
you
is
very
number
much.
5. Faiga. Spelling, what is the spelling? Faiga,
Fayga.
Fayga. Faiga. Second name?
Abdullah.
Abdullah. Abdalla. That's all, right?
Yes, right.
So this is Faiga Abdullah. Right. So take her name and you can just type her name and say, contact me. They will contact you. Otherwise, if you already saved the number, so you can contact them and slot your timings, fix your timings. Ashwini, you can do that part. Okay, because she will be busy with speaking sessions. She will not have that much time. So you can discuss with them and you see what are the slots filled already. You can maintain. Already you know what timings you are giving to everyone. Follow it up. And okay, Faiga, you can stop your video.
Okay,
and
thank you very much.
Yes, thank you very much. Thank you. Then CG Jason. These are our regular students, registered regular students, very special.
Hello, good morning, sir.
Somebody else. CG, are you at work or free now?
Yes, I am on duty, sir.
You are on duty. Are you comfortable? Just 10 seconds so that they will see you and they will have a chat with you.
Sure, sir.
Okay, this is for your own, this one. Yes, this is, we are very happy to see active nurses all over the world. This is a CG Jason. Yes, remove it. Yeah, CG Jishan, hi, say hi to our
Hi. Hi to everyone in the
coordinator and
group.
interlocutor.
Yes, I am CG Jason. I am working in Saudi Arabia currently. I am working as a NICU nurse. I started my OET maybe 1 month, nearly 1 month only. Not, and I didn't take any exam. And I want to take exam with the guidance of sir.
Yeah, you are the one who was referred by Uppula,
Srilata.
right?
Srilata.
Yes, Srilata Uppula. Yes, yes. Okay, fine. So, this is our coordinator, Ashwini. She will be following with you regarding your timings from now onwards, reading, listening, writing, speaking. How much you can do, you do and submit every day. Okay, in the group, So Ashwini, see that follow them up, follow them. If everyone is doing well, that means it is your plus point. You know what is plus point, right?
Yeah. Hello.
Okay. They are your blessings. They are your incentives. They are the steps for your promotion. I told you already. Okay. So you have to, it is your responsibility. This is our religion. This is our responsibility. Okay. So follow CGG, because it is very difficult for me to follow, because always I am on the platform or discussing with one correction and other things. I am doing all these things. So it is difficult for me to follow on. That's why you are appointed. Okay. So take that responsibility. And yeah, Ashwini, you can talk to her.
Your name? Your name? Yes. Hello. Yeah. Hello, Miss Ashwini. How are you?
Hi.
I'm fine.
My name is Ashwini. I'm from Kerala. Housewife. Now I'm cooperating all groups.
Okay. I'm also from Kerala, from Alua, Kochi.
Alva. Oh, you know Malayalam.
Yes, I know
No Malayalam, no speaking
Thank
in
you.
Malayalam in any class, anywhere.
I'm sorry, it's not allowed to speak Malayalam.
No way.
Yeah.
Only
Okay,
Okay.
fine.
From
Yeah, Kezia, just have a word with her. So this is our interlocutor. You cannot ask her anything, explanation or anything. She'll just be like an interlocutor in the exam. How she is, that is what she's trained for. And she will record the audio and she will send them to me. I will discuss with you. Okay?
Okay, sir.
Kezia.
Hello, my name is Kezia and I'm also from Kerala. I'm currently staying in Kottayam. I did my studies in BA English Language and Literature. Nice to meet you.
Oh, nice to meet you, sir. Okay.
All are Kerala. Only I am from outside. Okay, fine. Okay, CG Jishan, nice talking to you.
Okay, thank you, sir.
Right, fine. Okay, you can stop your video and you can mute your audio. Right. Okay. Next is okay. Yeah. So next we have, so CG Jason is number 6. Number 6, CG Jason. CG Jason, what you have to do is, there are too many CG. I don't know, I get confused. That's why I take second names also, CG Jason. Okay. This is number 6. CG Jason, you have to prepare the role play card and you have to get back to me. You have to practice. And every day you can take one speaking session with Kezia. Okay. Right, you can give your time and you can record these things. Then next, any regular student here other than that? Aswini, Boni, Faiga, Kezia, Laraib, Nasra, Pranita, Sangeeta Patel, Shemi Francis, CG Jason. Okay, there are some other visitors also. So we can give visitors one sessions. Ashwini, you can find if anybody is interested. You know, there are some free groups we are creating, and weekly one session you can give for the visitors. You can allot them weekly one session when she is free. Not when she is busy. You can give them time and they can attend. Yes, first let us start with the beginning. Who came at the beginning? That is Tricia. Yeah, Tricia, are you interested to take one session Shemi Francis, you prepare this. Yeah. Shemi Francis, you can prepare for the speaking session. I am going to conduct one speaking session for you. Ashwini, you have to follow with these things if they are ready for speaking session, okay, at the same time. Yeah, Trecia. Hello, Trecia, you can unmute. Sangeeta Patel, let me know if you are ready for the speaking role play.
No, sir.
Yeah, prepare. When you are ready, you can message here. Okay. Okay, fine. Trecia, are you there? So Trecia is on duty, maybe busy. Okay, next one is Boni. Hello, Boni. Yes. Fine. So we are going to yes, here is the card once again. This is the role play card. This is the role play card. This is the role play card. Okay. So yes. The screen, I have to learn many things. So that means I'm not able to project the screen. Okay. Yes. Okay. So right, all of you can pass your videos. Yes. Yes. This is the patient card. And this is the nurse card. So get ready. So Ashwini, you can follow up with the students if anybody is interested to come and participate in the speaking session.
Yeah, yes, sir. Actually, some
Yes.
students are on duty.
Yes, check them. Whoever, if even one student, one after another will take. If anybody is there free, let us follow them up. Yeah.
Okay.
Yeah, anybody. So, Tricia, if you are interested, you can participate in the speaking session. Boni, if you are interested, you can participate in the speaking session directly. Others, regular students, you can message me once you are ready. Yeah. Pranita. Hello, Pranita.
Hi, sir. Good morning, sir.
Good morning, Pranita. Are you at work or free?
No, I am free only, sir.
Okay. Fine. Very good. I'm going to introduce our people to you. You can have one speaking session every week. Okay. So whenever our instructors are there, I'm giving you the privilege because you are attending the sessions regularly. So I'm giving you the privilege to attend one speaking session. Okay. So you can, yeah, this is our, what's the name? Ashwini. Hello, Ashwini.
Okay, sir.
Yeah. Can you open your video? Say hi to Pranita. Yeah, this is Pranita, this is Ashwini. Pranita, open your video and introduce yourself. And Kezia, start your video. Yes. Yeah, Ashwini, you can talk to her.
Hello,
Ask her to send her the timing whenever you want. Weekly one session, you can arrange, fix the test session for her. Timing, ask her timing.
How are you? Good morning.
Yeah, good morning.
Yeah.
Okay, I'm the coordinating all groups, and
Okay.
I really happy to see you here. And I think Simon sir is full supporting all students. I'm really happy and appreciating.
Yes. Really. Semis are very supporting. Actually, I didn't pay any money, but I am attending classes, no. So, sir is very, very good heart, no. Why? Because we didn't pay any money means they didn't allow to classes. But sir will give chances to me also. Very excellent.
Yeah, Pranita, can you tell about yourself? A few sentences.
Yeah, I am from Andhra in Vijayawada. My name is Pranita. I completed registered nurse.
Vijayawada. Okay. Carry on.
Near to Vijayawada, sir.
All these people are saying, "Oh, you are Malayali. You are from Tamil, Kerala." They are very happy. So why should we not be happy? I am also from Hyderabad.
Actually, my husband in Chennai. Actually, now we are in Abu Dhabi. So I didn't work anything. Why? Because only 1 year I done my work. I did it my work. After that, I'm having 7 years gap. Now I am not doing. So I want to learn OET. As I don't know anything about OET, but nowadays, sir, when I choose sir in Telegram, after that, I'm very interested to OET. I don't know anything about OET. Please, you people are helping me. I will improve my knowledge and I will improve myself. Okay. Thank you so much. Thank you, sir.
Yes. So Ashwini, you can. Kezia, have a word with her.
My name is Kezia and I'm from Kerala.
Can you open your video, Kezia? Yeah.
I did my studies in BA. Nice to meet you, Pranita. So glad to know that class is helping you. I'll be speaking with you in sessions if you are part of it. Thank you.
Thank you. எனக்கு കുറച്ച് മലയാളം தெரியும். മലയാളം
No Malayalam.
Simon sir is not allowed to speak Malayalam. Really
No
happy to hear.
If I listen anybody speaking on Malayalam, that's an end in the classes. Total. Okay, fine.
Okay.
Yes.
Okay. Thank you so much.
So, Pranita, what you have to do is you have to ask the coordinator to fix a slot for you weekly once. Okay, she will be making speaking session because normally they are very busy with many students. So you can ask Ashwini, she will fix a slot and give you every week at the same time. You can have the speaking session. Weekly one session speaking you will have, and that will be recorded and sent to me, and it will be analyzed and sent to you if you are interested. Okay, Pranita?
Okay, sir. Thank you so much, sir. Thank you for giving this opportunity. Really, thanks a lot.
Yes.
Okay, sir. Bye.
Yes. Yeah. So next is we have next. Who else is there? Yeah. Next, Boni. So whoever is ready for speaking, you can just message me. So we can start the speaking sessions one after another. So Boni, yeah, message, at least message, no, you are busy or something. I'm taking your name many times. Then afterwards, I'll get a feeling that Boni is not interested in talking. So,
sir, I'm in duty.
Yeah, you are on duty. Yeah, just at least one sentence you should type. No, I'll be happy. So you are on duty. Very good. Okay, fine. So when you are free, you can get in touch with us. Fine. Then next is Tresia. Hello, Tresia. You can just message.
Yes, sir. I'll text it, sir.
Yeah, you can text me, no problem. You can just text me,
Yes.
and you can coordinate with get in touch with the coordinator Ashwini, and she will slot one speaking session per week. Okay, right. So Sangeeta Patel, are you ready? Ashwini, we have made a list in order, the 6 names. So can you type and post it in the WhatsApp group? All the 6
Okay, yeah,
names.
sure.
Yes,
Okay.
please. Make a list of them and put it in the WhatsApp group, Christmas group 1, so that I can check from there and I can follow it up. Yeah. Ashwini, send the link to Neha Ban.
Okay, yeah.
Okay. Because these people don't know that the link is already there. Because you are new, no, that's why they are thinking somebody is posting there. Okay. Yes. So, right. So I'm waiting for you. So the number 1 is, who is number 1 there? Number 1 is Sangeeta Patel. Okay. Number 1 is Sangeeta Patel. And number 2 is Larai. I'm copying from here and posting there. And number 3 is Shemi Francis. These are the regular students who are scheduled for the speaking session 3. And then number 4 is Nasra. Number 5 is Faiga Abdullah. And 6 is Jason. So these people will prepare and take the speaking sessions today. Okay, 1 to 6. I have made some thing for you, Ashwini. So, speaking slots today. Yeah, these are the people who have attended, and yeah, this list you can post it there. Copy this one and post it there. And the topic is what insulin injections. Yeah, in the meantime, today we are going to start with the warm-up session. Yes. So others, Sumbul has come here today. Yeah, Neha Banu. Hello, Neha Banu. This is one of the students, special students. She's also going for the exam this month. Hello, Neha. Unmute.
Good morning, sir.
Good morning. Yes, Ashwini, say hi to Neha. Neha
Hi.
Banu.
Yes,
Neha
Hi.
Banu, you can open your video, and Neha Banu, you can open your video whenever you're talking. Okay, you can open your video. And this is Neha Banu from Hyderabad.
Hi, good morning.
Good morning.
Yes, Neha, can you please open your video if you're comfortable, please? So we are.
Sorry, sir.
Yeah. Okay, fine. If you're comfortable, that's okay. That's okay. So, Ashwini, yeah. Your duty is to fix up the schedules, and you have to take the reading, listening, writing, and fix the speaking slots. For her also, you are going to give extra sessions. You have to give her, when is your test date, Neha? 3rd or 17th?
17 December, sir.
17th. So after 3rd, you have to give 1 hour for her every day. Okay, Ashwini?
Okay, yes. Sure.
Okay.
After 3rd, you have to give 1 hour every day. Till then, you have to give 1 speaking or 2 speaking sessions every day. Is that clear?
Okay.
Okay. Yeah. Kezia. Kezia, can you say hi to Neha?
Hello, Neha.
Hi, how are you?
Yeah, she is the interlocutor. She will take speaking sessions for you. whenever she is free, she will give an additional one more session. So you can have one session in the morning and one session in the evening. Kezia, note down. So you'll give 2 sessions for her, one in the morning and one in the evening. Okay. Right. So, yeah, Neha, you can coordinate with Ashwini and you can get the slot timings. And you can, Ashwini, you have to slot the timing for writing correction also for her. Because whenever I try to call her, she will be busy. Whenever she calls me, I'll be busy. Like that it is happening. So she's missing the slot for correction. So today also make some time and fix her slot in the afternoon so that I can give corrections.
Okay, yeah, sure, sir.
Okay. So you message in the group, Neha. Neha, in the group, you are getting the messages, not personally. So the links are already given in the groups. You can join from there. And this is the role play card. Yesterday we have done in the evening. And this is insulin injections. You can prepare and come back. Okay.
Okay, sir.
Neha, Banu, you can prepare and come back. And only you and I will be there. And we'll do the speaking session here. And I'll give you the feedback on the spot and I'll give you special feedback later also. Okay. So you have to be ready and you have to be, okay. So you can come on the video also and you can participate there, but you can get that real feeling that, oh, yeah, I have to do my best because everyone is watching. You're doing well. Very nicely you're doing. So I appreciate your performance. So number 7 is Neha Banu. 7 is Neha Banu. Write down the names. Neha Banu. So if they are not completed the speaking session, you have to follow them up, Ashwini. They have to take the speaking sessions with me 5 minutes before. Neha, hello,
Yes.
Neha. Yeah,
Sir,
you are
yes, sir.
going to do the speaking session with me today. Prepare well and come. I am here now, and you can take 5 minutes, and I'll conduct your speaking session now. And get ready. So fine.
Okay, sir. Sir, this
Yeah.
same card?
Yeah, same card. You can prepare and you can come.
Okay. Yes, sir.
So once you are ready, you have to say, I am ready, either to Ashwini or in the chat box here. Okay. So the
Okay,
same
sir.
card, insulin injections.
Yes,
Ashwini sent the card. It is there in the Christmas group today. And otherwise, Ashwini will send you the card. Okay, you can message Ashwini and she can send you the card. Yeah, next. Who else is there? Laraib says, hello, sir. I prepare. Very good, Laraib. Very good. Wonderful. Wonderful. Laraib says, I prepared. Yes, we are starting with Laraib. Laraib's number is number 2. Laraib, ongoing session. Number 2, Laraib Adil. Laraib Adil. Everyone else, mute your videos and audios. Nobody's video should be on. Nobody's audio will be on because I am going to stop everyone's audio, but video you have to stop. Yeah, ongoing session. Ongoing session. Yes. So what you can do is Laraib. Everyone else, I am muting. Nobody can speak. So everyone muted. Mute everyone. So mute every video. How to mute every video? I don't know. So fine. Now next, Laraib Adil, you can start your video. You can open your mic. Yes. Laraib Adil. Ready. Hello, Laraib, unmute. Laraib Adil, unmute. Laraib Adil. Laraib Adil. Unmute. Yes. I'm giving you opening, I'm clicking. Just click on that one. Ask to unmute. Yes. Are you there? So you can unmute. Next, if anybody is there ready for speaking. Pranita, if you are ready, you can go for speaking. Okay, Lara, when you're ready, message again. Yes. Tresia. Tresia, are you ready for the session? Okay, anybody who is ready, just type your name. I am ready. Because Lara is, I think, busy. Tresia or Shemi or anybody who is ready can type the message. I am ready. And Ashwini, be on the watch. If anybody is there, they have typed. I missed actually Lara when she messaged me. Lara said, yeah, Shemi Francis says, I am ready. Okay, very good. We are starting Shemi Francis. Shemi Francis, that's right.
Hi, sir.
Yes, Shemi Francis, you are fine. You are at home. Now you can start the video.
Okay, sir.
Right, you can start the video. You are very special now. You are very, very special now. Yes. So now let me open the role player card from my tab. So Zoom is working fine. YouTube is working fine. Yes. Right. Yes, Shemi Francis. Very good. So Christmas badge. Yeah, let us check the speaking role play card. Yes, the role play card is here. Yes. So the role play card and the patient card. Yes. So you are ready, you can start.
Excuse me, how can I address you during role play, sir?
Yes, you can address me as Abraham Lincoln. You can call me Lincoln. My name is Abraham. You can call me Lincoln.
Abraham Lincoln. Thank you. Can I start, sir?
Yes, of course.
Okay. Good morning, Abraham Lincoln.
Good morning, nurse.
I'm happy to see you again. Okay, please be seated.
Thank you, nurse. Thank you very much.
Abraham, as you know, my name is Shemi Francis. I'm one of the registered nurses in this clinic, and today I'm the one who take care of you. Mr. Abraham, I found from your case file that today you are here for self-administration of your insulin for your diabetics. But for my better confirmation, could you please tell me the reason behind your visit in your own words, and how did you feel about your insulin injection?
Yeah, actually, nurse, I am doing well with my diabetes diet, medication regimen, and exercise program. What's wrong with this, doctor? Okay, why should I think about these things? Why should I change my treatment plan? I don't understand. Can you explain me the reason?
Oh, I can understand your concern, Abraham, but I know your current you are well controlled your diabetics with diet and oral medication still now, but your current blood sugar report shows little bit high today. For the fast proper management, it is important to start insulin therapy. Could you please share me the reason behind your anxiety? Is it due to injection process or fear of pain or needle? What do you think, Abraham?
Yeah, I am a bit anxious, nurse, because I'm unsure about starting insulin injections because everything is going on well. And actually, I'm scared, I'm scared of these things, doing something new. I am not at home with these things.
Oh, Abraham, I can understand your concern, but no need of overly concerned about that. I will explain and teach you how to how the procedure that you have to follow and how to keep the medications, how to inject the insulin therapy. All things I will teach you and explain to you. Is it okay for you?
That's fine, nurse. I really appreciate. But the thing is, I don't like the idea of giving myself injections. It looks, embarrassing. And the thing is, I don't think I'll be able to do it because I'm scared and I'm afraid of taking injections. Even when a nurse gives, then how can I take, you think?
Abraham, I can understand the worries you have, but no need of overlay. In your current situation, you need to take into your current management like diet and oral medications are not working because your insulin level blood sugar level is little bit high. So it is when you start insulin injection, it is easier to fast absorption into the bloodstream, and as well as it is not broken down into stomach, and it is more effective than the oral medications. Are you getting my point?
Yes, of course, nurse.
Okay, Abraham. I'm assuring you that administration of insulin injection is not a difficult procedure. We can do ourselves easily. And can I explain the procedures for your better understanding?
Yes, nurse.
Thank you, Abraham. First of all, before the procedure and after the procedure, it is important to wash and dry your hands. And whenever you injecting the insulin injection, pinching your skin and insert the needle around 90-degree angle and leave it in place for 5 to 10 seconds. And it is important to rotate the injection site accordingly for preventing formation of lump as well as the risk of less insulin absorption. Are you following me?
Yes, nurse, of course.
Abraham, one another important thing is about proper disposal of needles. After use, we can use the suitable containers, and care should be taken to handling the needle for preventing further infection also. And do you know about the storage of insulin?
Actually, nurse, I have a big problem. Okay, I want one piece of information. I want to ask you one particular thing. Is there another way to manage my diabetes? I would prefer that rather than taking insulin. Can you tell me why no other option is there? Can you just check it out and tell me?
Abraham, as you know, you are till now, you are managing your diabetic with your diet and oral medications. But in your current situation, your blood report shows little bit high in your blood sugar levels. So your doctor decided to start insulin injections for you. That is better for that is better than your current oral medications. As I told, no, this is more effective and faster absorption into bloodstream and help to decrease your blood sugar levels more faster than your oral medications. There is no other way to decrease your blood sugar level right now. Is it okay for you?
That's fine, nurse. And I understand. I understand. All the information is clear. Yeah, now, should I take the injection in the same place every day, or should I rotate the sites? Or what do you think? Are there any complications or side effects for that?
Oh, your concern is reasonable, Mr. Abraham. It is important to change your insulin site according to rotate the injection site. It is important because there is some sites are you can do it in both thighs, abdomen, back of the shoulder, and in your hands. These are the some places of sites of insulin injection. When you take insulin injection, this is important to change your site because we are doing insulin on the same side that may cause the formation of lumps, as well as risk of less insulin absorptions. So it is important to change the site at every time when you're taking injections. Is it clear to you?
Yeah, that's absolutely fine, nurse. Thank you very much. And what should I do with these used needles and syringes? What am I supposed to do with that? Should I just discard that as other trash things from the house?
Yes, Abraham, your question is reasonable. I will explain to you what the proper disposal of needle and storage of insulin, everything I will explain to you. Abraham, it is important to buy a suitable needle container for the proper disposal of needles, and it is important to proper care and handling of needle whenever you are using this needle, and as well as the disposal time also, for preventing further injury and formation of infection also. uh, did you understand what I'm saying, Abraham?
Yes, of course, nurse. I'm very clear regarding that. Thank you once again. Thank you very much, nurse.
Do you have any more concern, Mr. Abraham?
Yeah, one request from my side is there any literature or are there any brochures or leaflets or pamphlets or anything which I can go through because it is my life and I am concerned. So I want to learn more about my present condition and how to do with these insulin injections.
Oh, that's the one of the and the good idea you have told me. Um, Definitely, I will provide a leaflet that contains all the information regarding the insulin administration, as well as the disposal, and also the proper storage also. One another thing is that the proper storage of insulin is that if you are unopened insulin, you can refrigerate the insulin and not to export it to sunlight or in high temperature. And one another thing is that check the expiry date also. um, I will provide you the one of the leaflet for, that contains all the necessary things as you want. Is it okay for you?
That's fine, nurse. That's absolutely fine. Thank you once again. Have a nice day.
Okay, thank you, Abraham. I hope you have will to do a self injection of insulin.
Yes, nurse. I give my consent and I will try to do my level best.
Okay, thank you, Abraham, for your patience and
But I
cooperation.
need you to support me for quite some days, at least 3 or 4 days, or if necessary, 1 week.
Definitely, Mr. Abraham, I will assist you how to take injection for the first 1 week. If you're confident, only I will allow to take yourself. Thank you.
Thank you very much. Okay, that's very fine. First of all, I appreciate you. Right. Yeah, what I will do is new screen share. So, yeah, first of all, Your birds are also learning speaking, huh? Your birds are also chirping. Okay. So
Yes,
next,
sir.
comfortable zone. Suddenly you came and I said, okay, but be in comfortable zone because they'll be distracting you. They'll be distracting me, of course. I think you got the feeling of a real OET exam, right?
Yes, sir.
Correct.
Of course.
This is the
Yes,
you
sir.
are going to perform. So when you come online like this, live, everything you can see, you will get that feeling, that real feeling of the test, and you will get encouragement to practice like this, so that in the real exam you will not panic. You understand?
Yes, sir.
This is the world is seeing you, so how much careful you will be. So you'll get a practice to overcome that fear. Already you overcame that fear, almost. Still, you have to come out of that one. And when you go into the real examination, you feel, and this is one practice test. Like that, you will feel that. And every practice test you see like a real test, and real test you will start feeling like a normal test, everyday test like that, and you will dance very much that day. That's what I'll tell you. Yeah, tell me about your experience of this speaking session.
Sir, it was very nice experience for me. I feel the real exam day. Like you, as an interlocutor, you helped me a lot, and I don't think I had done very well, but it's okay for me.
Yeah. Yeah, you said, I don't think I have not done very well. Yeah, you have done very well, but definitely not excellent or outstanding. You have done very well. It's not that you did not do very well. There are 3 degrees: good, better, best. You have done the good part. Now you have to go to better and then you have to go to best. You have to raise 2 levels. There is nothing wrong in your speech. It's very fine. Okay. Nothing wrong in that one. It's no negative. Be positive. Is my blood group. Okay. So I think you can definitely overcome. Yeah. Do you have any questions to ask before I give feedback? I'm going to give you feedback now. Before that, do you have any questions?
So from this test, I have confused that your 60-year-old patient. That means we know that patient, no?
Yes.
That was one of my concern, that in the clinic they are arriving, and so that is why I am asking during first your name.
No problem. You can ask. That's not a problem. That's not a problem. Those things will not matter that much. They're very minute. Every sentence you speak is more important there, right? Not that much formalities, but the 3 things are concerned here. First, mainly grammar, vocabulary, and pronunciation. Focus on these things mainly. Okay? Focus on these things mainly.
I have some grammar problem also, and that some phrases.
No,
that
you
also
don't have any stammer problem. Stammer problem is something different. Stammering is something different. I did not notice that. I did not notice that stammering in anywhere. You were getting stuck. That is lack of thought processing. Is I will discuss with that one later. I have written a point there. So it's not stammering. Stammering means every 4th word or 5th word you will get stuck. The throat will not allow. That is stammering. You don't have that problem. Every 4th or 5th word, that is the stammering problem. First one word goes, automatically 3 or 4 words goes. And again, whenever new phrase comes, the first word will be a problem. Otherwise, you don't have that one. No worry. Yeah, next.
That's
okay. So fine. So you can do speaking sessions. Shemi Francis, you have exam on the 3rd of December, right?
Yes, sir.
You can have 1 hour with the interlocutor, morning half an hour, evening half an hour, like that. And you can practice. You can give her cards and she will ask. Okay, you can practice. Okay. Then next one is you can have 1 speaking session every day with me like this. Okay. Where I'll give you speaking session, so that you overcome that fear, and don't speak any Malayalam with any staff member. Okay.
Okay,
Anybody
sir.
speaking Malayalam, you have to tell me. Okay. Right.
Okay. Okay.
Then next one is Yeah. Shall I go with the feedback? Yeah, you can keep your video on. So fine. Number one is you are telling Abraham many times. So one time is enough. Time and again you are saying, I did not change my name there. And you know only Abraham is there. And I also know that I am Abraham. I did not forget my name. So no need to take my name again and again. It only reduces your quality time where you can focus on something else. That shows that you are personalizing them rather than formalizing. Personalizing means you are treating the patient as your friend or something. Of course, you have to treat him as a friend, but not in the terms of every time calling him by his name. Even your daughter, you will not call every time by name. You'll say, come here, sit down. When only one person is there, you will not call by name. Come here, sit down. First only you'll say, what's the name of your child? What's the name of your child? Yeah, okay, I have to give you unmute. Okay, yeah, unmute. Yeah, tell me. What's the name of your child?
Angelique.
Angelique, okay. So you call her first name, then afterwards you say, come here, sit down, eat food, don't waste your time. But every time you will not say your name before every sentence, correct? No need. No need. Once it is enough, subject is more important. This is not personalization. This is formal, official speaking test. Okay, right. So sometimes, if you take the name and call, it's a disrespect. Sometimes. Why are you taking my name every time? That's it. Yeah, I'm there. I'm only one person. Why are you telling my name every time? Like that one. It's sometimes people don't take it very nicely. Okay, one time you take the name, that's okay. Then number one, that is it. Avoid taking the name of the patient every time and again. Number one. Number two, you're saying in between sometimes. Because you are stuck with words, you don't know what to speak. Then you are started thinking, then your mouth is already open. So sound comes out. Sound comes out. Right? Sound comes out. So you have to avoid those things. If you don't have anything to speak, just silent. Just silent. Okay? So just stay silent. Keep your mouth zipped. Don't open your mouth. See, I'm also speaking. When I have nothing to speak, then I continue when I am ready. Then I am ready. I'll just continue. Is that clear? So avoid these unnecessary sounds because they don't have any impact. They don't have any meaning, result, or sense. They don't give any weightage to you. So these sounds only show you that negative side of you. For example, I tell the sounds. I use sounds many times. Okay. Oh. Yeah. I do sounds. That means these sounds have meaning because I wanted to use these sounds. But you, unwarranted sounds you are using. That means you don't know that you are making that sound also. But I am making the sound with an intention to express something. Means yes. Means no. Even nodding the head is a yes. Expressions also are there. You understand? So expressions are also important there. We'll see that later. These are unnecessary sounds. Avoid them. Number two. Number three, pauses and breaks. When your mind is not ready, then you start speaking. After 2 or 3 or 4 seconds, you are speaking sometimes. There's a gap. That is called zero talking time. Sometimes I am talking, interlocutor time, talking time, your time, nurse talking time, candidate talking time, examiner talking time, and the zero talking time where you are not speaking and I am not speaking, that time. So zero talking time should be zero. You understand? So you have to avoid those pauses and breaks where as null speaking. Then fourth one is thought processing is average. Thought processing. Your thoughts are not flowing sometimes. Sometimes you get what to speak next, what to speak next. So you are thinking like that. You are thinking like that. That is the problem. Thought processing is average. Sound subject knowledge. You have excellent knowledge on the subject, but how to utilize that knowledge, you're not able to do it. You're not able to utilize that knowledge. Try to utilize that knowledge properly. Organize the sentence like this. You asked me about how to dispose them of. Yeah, here is my answer. Now, this is a container. This is a disposable container. You cannot dispose the sharp needles like you dispose the other things, garbage and other waste things in your house. These are of high priority because needle prick injuries may happen if carelessness is there. So what you have to do is when you use the syringe or needle, before that you have to keep them safely out of reach of children or anybody else, because absent-mindedly you'll be placing your hands here and there, you'll get these needle prick injuries. So what you have to do is, yeah, here is a sharp container. This is a disposable container. You see this one. You have to manage this every day. Once you use the needle and syringe, you open the lid of it and put the used syringes and needles in that and tighten the lid once again immediately and keep it safely in a safe zone out of reach of children or anybody else. And once the container is 3/4 full, don't wait until it is full. 3/4 full, you can call us on our office number or me personally, and someone can come here and with a substitute container and replace the filled container with a new container and take it back to the hospital. So, all these things, So how you are dealing with that in an organized way? Yes, you are supposed to take the injections. Don't take the injection the same site every day, time and again, because there may be some problems or side effects because of repeatedly taking. There may be some bruises or maybe some swelling. So what you have to do is you have 5 different sites. One is the left and the right shoulders, the left and the right thighs, and the area surrounding the belly button. These are the 5 locations where you can take the injections. So what you have to do is you have to rotate the sides on a daily basis. Today you are taking on the left side. Tomorrow you have to take on the right shoulder. And day after tomorrow, you have to take on the left thigh. And the next day, you have to take on the right thigh. And on the 5th day, you can take around the belly button area, in the belly button area. So this is how you are going to do. Faiga, wait, please. I'm coming to you. Okay, put your hand down. I'll get back to you. Once the feedback is done, I'll come to you. So, and kindly remember yourself, and it is always better to keep a diary, and in that diary you can note down which day where you have taken, so that by mistake you do not inject on the same site on the next day, to prevent any complication. See how I am talking? You understand what I'm telling? So if you have a lot of knowledge, you can speak well. No need to speak too much. You can speak well. So that is how you have to organize your sentences. The next one, you have sound subject knowledge, but practical knowledge, mere knowing is knowledge. Application of that knowledge is wisdom. Not using that knowledge is foolishness. You have knowledge. You have knowledge, but you are not using that one. It shows that you are not aware of that one. That's all. If you are aware, you have to use that one. So that becomes you are wise. That makes you wise. So organize your sentences. Next one is vocabulary. Your vocabulary is average, not very excellent. You have to improve on the vocabulary. Disposing, utilized, sharp, medical instruments is extremely important. See the quality of words which I am using. If you say, do not throw the needles and syringes like other things, you will say, suppose. But my style of saying is, disposing sharp medical equipment in appropriate manner is extremely necessary to prevent needle prick injuries. See the sentence. Go to the YouTube, copy down this sentence and keep it in your, so you can use it and adapt that style to any other area. You understand? And you can use the words and sentences and phrases, right? The next one is grammar. Grammar, you can use simple, complex, compound sentences. You can use sequencing things. Firstly, you have to take the needle, load it with insulin, break the vial, insert the needle, then plunge the needle and draw the insulin into the syringe. Now keep it on the table, take a cotton swab, rub the area, and now inject. Keep it on position for 5 to 10 seconds and then remove the needle back. So step by step you have to explain. First, then next, afterwards, finally. Okay. So these are the ways how you can improve quality. Then grammar. If there are any bruises, contact us immediately. Don't take any action on your own, because you may intensify the situation. So let us do the job for you, because we are professionally qualified to handle difficult situations in the right manner. You understand? So you are using if, you are using because, and you are joining 2 sentences together or 3 sentences together. Correct? So complex compound sentences you can make. Then next, pronunciation. Pronunciation, how you can improve your pronunciation. Take an audio, listen to the audio and repeat the sentences he is speaking. Or play the audio, keep the audio script in front of you and speak along with him. So you will know. Maybe first day it will be very difficult, but afterwards, along with the audio, you have to speak. So you will know how to speak fluently automatically. If you are slow, you will increase speed. If you are fast, you reduce speed. You understand now? Audio script, you ask me, I'll give you audio script, I'll give you audio, I'll give you everything. Whatever you want, you ask me, I'll give you. Right? Then next, pronunciation. Then fluency. Fluency is a little bit problem. Okay, you have managed, but fluency means the way how you are speaking without any breaks and pauses. That is the fluency. It's not fast or it's not slow, it's not average, it's fluency is fluency. Continuity of speaking word after word is called fluency. The continuity of speaking word after word is called fluency. The continuity of speaking word after word is called fluency. One is slow and one is fast. It doesn't matter. Fluency is there in both. You understand? Next one, accuracy. Accuracy, you have some grammar mistakes. So those are mistakes. Accuracy in pronunciation, mistakes are there. Vocabulary mistakes are there. So let us see. For example, We can do ourselves. You said we can do ourselves. It is not ourselves. It is ourselves. VES, plural. Myself singular, ourselves plural. Selves, za. Ourselves. SELVES, not SELF. You said SELF. Go and listen to your audio. You said ourself. We can do ourselves. No, we can do ourselves. Okay, we can do ourselves. The next one, this is grammar mistake. The next one, 5 or 10 seconds. 5 or 10 seconds. S is missing there. 5 or 10 seconds. I made points here. 5 or 10 seconds. Be very careful. Singular, plural, it's a mistake. The next one, are you following me? Do you think that this is a question at all? Is this a solid question? Is this required? What do you think? I cannot follow you. I'm 60 years old. I cannot follow you. You mean I don't understand your English? Or I don't understand your reasoning? What do you think? That means you are underestimating me. If I ask you the same question, you'll say, what do you think? I'm a small kid? Or I'm mentally insane? Are you following me? What do you mean by are you following me? Why can I not follow? I know English. I'm speaking in English. Correct or no? Correct? If you ask like that, people may be offended sometimes. Okay. So how can you think that I'm not following you? What made you think that I'm not following you? Am I doing something else or what? I am with you. I'm looking at you. This is very important for me. How can I not follow you? So what the question you can ask is, instead of this one, I believe, you can not note down from the YouTube. Don't do anything now. Just listen. I believe that I have explained everything related to taking insulin injections and the procedure. And still, if you have any doubts or if you need further clarifications, you can ask me and I'm ready to help you. This is English. This is English. Okay. This is the way how you have to ask. Are you following me? He will say yes. Or he will say no. So you have to make him come out with his points. No, nurse, I don't have any doubts. Oh, yes, nurse, I will have something to ask. And he will go ahead. You need not say, yes, tell me. You need not say, he will tell himself, all by himself. So make him respond to the question properly. Are you following me? Yeah, I'm following you. I'm listening to you. That's the meaning. So instead of that one, make him think and follow your points. So next one, avoid personal pronouns. You have to, I will explain, I will tell you, this is it, it is important. What is this I, we, you, he, she, it, they, ourselves, all these things? Why are you using these things? You are using personal pronouns. You are personalizing the speech. This is an official session, formal session, official and formal. So you have to use formal jargon, official jargon. Avoid, you're talking to me as you're talking to your friend. I will give you this. You come here, we'll go there, we'll sit here, we'll enjoy, we'll have our dinner. There's nothing. There's casual talk. Come out from that casual talk. Make it formal. First, the procedure to self-inject, self-administration of insulin injections will be explained. Then the same will be demonstrated. Where is I, where is you, where is it? The procedure of self-administering insulin injections will be explained, following which the demonstration will be given. First theory, then practicals. You understand what it is. Education, initially, the education regarding self-administering insulin injections will be provided. Once the knowledge is imparted, the same will be practically demonstrated. Finish. No I, no you, no it. It means insulin injections. You means Mr. Simon. I means Shemi Francis. Is that clear? It's okay. You're doing fine. You're doing fine. But you have to get an A or at least a B plus. Right. Next one, avoid active voice. I will give you insulin injections. Insulin injections will be given. Education will be provided. What is important? You are thinking that you are great. You are extraordinary. You are special. Why you are special? In your place, any nurse, Larai Badil can do. Neha Banu can do. Anybody can do these things. Anybody can do these things. Then what are you special for? Why are you bringing I and making it the king of the sentence? Every sentence has something which is very important. Neha Banu, are you there? Just type if you are there. So, now what you are doing is, you are not special. In this sentence, insulin injection is important or education is important. Insulin injections, education regarding insulin injections will be provided. Insulin injections are important. Education will be provided. See, insulin injections are extremely important. Therefore, education will be provided. So passive voice, I will give you, where I and where you, I will give you information about it. I will give you information about it. Only one word information is there. But I is important, you is important, it is important. These are not. Information will be provided. No I, no we, no you, no it. No I, no we, no you, no it. Is that clear? That's the point. Done? The next one. Avoid repetition. Avoid repeating words and phrases. Avoid repeating words and phrases. Even Abraham, I, yes, Neha, I'm coming to you after this one. Be there, don't go. You are important because you are also going for the exam. Okay. Now, avoid repeating vocabulary words. Are you following? Are you following? Is that okay? Like that one. You, I, we. If you use these words, you will be repeating these words time and again. So stop them totally. Avoid. And definitely you will get A grade. Don't doubt me. Just trust me. Just trust me. Just trust me. Just trust me. So, next one is more faster. More faster. More faster. What do you mean by more faster? It's already comparative degree. Fast, faster, fastest. When faster is there, then why more again? Intelligent, more intelligent. When you cannot use ER, then you use more. You understand now? You're already using ER, then why more? Got the point? There is nothing called more faster. Means you are duplicating. You're duplicating it. Faster means more fast. That is understood. Fast is small word. So you are adding ER to that. Fast, faster, fastest. These are regular adjectives. These are called regular adjectives. You add ER and EST to them. Some there are standard adjectives. Intelligent, you cannot change it. You can use more intelligent, most intelligent, because you cannot use intelligenter, intelligentest. You cannot say. It sounds awkward. For those you use more and most. You got my point, right? So it is a mistake. It is a mistake. The next one is either use ER or use more. But ER for certain adjectives, more for certain adjectives. ER for certain adjectives, more for some adjectives. Hello? I am in a session, please. Afterwards, I'll get back to you. Don't call me. You message me on WhatsApp, okay? I'm in a live session online, please. So, confidence level is average. No need to worry. I am there. I am there. I'm the commander. You're just a soldier. I'm telling run means run. Do mistakes. How many mistakes you want to do, you do. Fight. Mistake is mine. You understand? If you are doing mistakes, that is my mistake when I am there. For example, your daughter is going along with your husband. Father and daughter are going outside. If daughter is going alone, the responsibility is daughter's. Why did you go out without informing me? You will tell. Because it's a mistake. Something happened. You fell down. You hurt yourself. Now see the problem, you'll tell. You'll shout at your daughter and scold your daughter. Don't go next time, you will tell. But for example, if your husband goes along with the daughter, you will not tell anything to the daughter. You will tell your husband, what are you doing? See, the child fell down. The responsibility is shifted to the father now. You cannot take care of your daughter. Why did you take her? If you have taken her, she's a child, she does not know many things. You have to take the responsibility. So in the same way, I am your father here and you are my child here. You understand what I'm telling? So if you are doing your mistakes, when you are under my training, it is my mistake, not yours. Do as many mistakes as possible, no problem. Do mistakes. Do as many mistakes as possible so that you can recover all those mistakes. Okay, if you don't speak, you will not do mistakes. If you not do mistakes, there is no chance of learning. You understand, or correcting. So do as much as possible. Next one. There is some sites. There is some sites. What do you mean by there is some sites? Some means plural. Sites means plural. There are some sites. Now, don't you know some sites? How many are there? There are 5 sites. You know that. Very clearly, only 5 sites. Correct? Then why don't you be specific? There are 5 sites. You are using generic. There are some sites. Some sites means how many? You are not giving me 100% perfect picture. Correct now? There are 5 sites. There are some sites means how many? 5, 10, 15, 20. I will imagine. You understand? You have knowledge, but you are not utilizing that knowledge. That is what I'm telling you. And then the last one, 20th point. Avoid commonplace vocabulary. What everyone is speaking, you don't speak that one. Everyone is telling something. Everyone is telling something. Don't speak those things at all. For example, somebody is telling, are you able to understand? Hello? Yes, please. TVS showroom. Okay, I'll get back to you. Can you send a message on WhatsApp, please? I'm in a session. Thank you. So, avoid commonplace vocabulary. Everyone is telling, how does that sound? How does that sound? Don't use. Unless and until you know the importance of how does that sound. Don't use. The next one. I reassure you. Don't use that word. Everyone is using, don't use that word. People don't know what is reassurance. They just say, I reassure. What nonsense you are speaking? How does that sound? It's nonsense. You have to say like this. If you want to say, I reassure you, you reassure them. Not use the word, but use the explanation to reassure them. Means reassurance means comforting them. The word indeed is needed, not in words, in deeds. Don't you worry. How can he not worry? He's in pain. If you say, don't worry, how can you say, don't worry? You're in safe hands. What safe hands? How? Prove that he is in safe hands. Just words will not reflect anything. Now, how to give reassurance? I'm telling you how to give reassurance. Afterwards, you can note down, not now. Yes. Your concerns are quite reasonable, and I definitely understand. Let me give an explanation. Let me give you an explanation regarding this. You are not the only one person who is having diabetes. There are many people in the world, almost 5 to 10% in the world are facing this problem. That means there are thousands and thousands of people who are facing this problem, and you are not alone or singled out. When all these persons are managing with their diabetes injections, they are able to take injections, then why can you not take this? Oh, so I should not worry because there are many people like me. So he will feel like that. He'll be comforted. They are able to manage, they are leading normal life. In the same way, you need not worry because I will explain you everything and you can lead a normal life without any pain if you are compliant with this insulin regimen. If otherwise, you will face some problems. So to prevent them, it is mandatory for you to take insulin injections. And if any problems are there, we are there for you to assist. Just a phone call. We are there to help you. Your health, your safety is our fundamental priority. After considering all the things, the general practitioner has prescribed you insulin injections. He is professionally qualified and he has the authority to guide you properly. So trust that you are in safe hands. How does that sound? Now, this is the way how you have to use. I did not use the word reassurance, and I did say, oh, no need to worry, you'll be fine. How can you give wrong information? How can he be fine? He's in pain. He's anxious, he's worried, he's tense. How can you say, don't worry, just like that? Say, first give him the reason why he should not worry, and automatically he will stop worrying, right? Yeah. Now, I'm unmuting you. I'm unmuting you. Yes, tell me. Yes. Yes, you can start. Yeah, you have to unmute. You can unmute. I have given you a chance to unmute, but yeah, you can speak now.
Sir, now I cleared all the mistake I have done during the session. It's very beneficial, this class to me. I have done almost 20 to 21 mistake this road play card.
No problem. Mistakes everyone will do. Carry on.
I understood what all are the things I want to clear this section, and it is very nice session for me.
Yes, weekly one session I'll give you like this, okay? Because you are going on the exam. Okay, every day I will take sessions, but
3
this
days
length
is remaining
live
for
session
me.
I give once in 3 days for you because your exam is approaching. 3 or 2 days once or 3 days once. Every day I'll conduct 1 or 2 speaking sessions. That is different. Okay.
Okay.
Don't
Sir.
ask every speaking like this. I cannot. correct? Because of the time frame and everything. So whatever I gave you, use it for the next 10 speaking sessions. And day after tomorrow, again, I'll give you one session. Fine?
Okay, sir.
So that's
3
end
days
of
only for me.
Yes, fine, fine. Yeah, next. Yes. So all of you can give your feedback regarding this particular session. You have 1 minute. Hello, everyone. Give your feedback. Give your feedback regarding the session. That is for everyone. Sumbul, I'm doctor. Do you have doctor speaking card? I want to do that. Okay, I'll give you the doctor. You can message me on WhatsApp. You can message me on WhatsApp. Yes. So you can give your feedback, all of you. Please, 1 minute. Then I'll have my breakfast. And afterwards we can join. Hello, Neha. Yeah, Neha. Yeah. So you have one writing correction and one speaking session. Okay. So now it is 11:57. Shall we take it 12:30? I'll have my breakfast and we'll start direct. First we'll take speaking, then we'll go for writing correction. Okay. Okay, dear. Just remind me exactly 12:30. Okay, dear. Yeah, I'll give you my WhatsApp number. Yeah. So all of you know it. So why should I give on it? So you can just type your comments. Yes, that's the end of the show now. If anybody has, okay, select all, copy. Yeah.